we involve everybody in. So all the solutions that we aggregate and adopt were primarily designed by our staff and our volunteers. And many of them were done in conjunction with the people that were the final beneficiaries of the intervention. Remember, our intervention was a holistic intervention, was a therapeutic intervention, a psychological intervention, a social intervention, a judicial intervention, because we have also we give support on judicial matters to our public. So we did that not only by creating solutions. So we understood that it was needed to train and to prepare our staff and our patients to this change. So at the same time that we decided to put everybody thinking about solutions, basically digital solutions, we start training everybody. So the first part of our commitment was to give to the people the basic knowledge to use the tools. So what we did, we invite our volunteers that had skills in teaching and skills in the digital world in order to create simple programs of education and fast education of people in using these tools. So what we did, we adapt our main communication channels. So we adapt our website to this task. We adapt our social media networks. We adapt Facebook and YouTube pages that were the two main tools that we had in March of 2020. And we also design several hubs of aggregation of the contents, because at a certain point we realized that the needs of the people were not all at the same instant, were not equal at the same instant. So it was stupid to give people advice in psychology if they needed physical rehabilitation, or to give them advices on judicial matters if they need social support. So we designed 3 different hubs in order to give the people the proper information and to make a kind of separation on subjects. So we create the in-house more informed, to avoid the noise of the information that was pumping in every day through the medias. So we select highly quality information, and especially we select information that they could understand in a plain language, that it was easy to the people to understand. We act in-house but active, so everything that was related with physical rehabilitation, neuro rehabilitation, physical exercise, everything that you can imagine all on the interventions, more technical interventions like speech therapy, or physical or yoga classes, or pilates workouts. And then we also create a hub for the people to be at home without fear, without with the mind appeased by different contents like mindfulness, psychological exercises, social gatherings, peering groups, etc. So a little bit like Alcoholic Anonymous groups, like people that had problems and discuss among them. And then what was interesting is that everybody put their modest resources on the game. So all the staff, all the volunteers start to use their digital devices in order to help the interventions. So nobody was waiting that we had the money to buy mobile phones, tablets, new computers. So everybody uses their imagination and their own tools and put it in the effort of contacting the patients. And even from the patient side, it was the same. In many cases, some patients received from family iPads, mobile phones, computers in order to be able to connect to us. So, and also we received many grants from companies and from individuals to help in this process. So everybody was pushing in the right way in order to help us to keep in touch with the people and to improve their situation. And we did it. So we did it in our physical installations. We didn't close. In reality, what we did was to create a kind of a safety bubble in our intervention. We reduced a lot the quantity of people in each place. So in order to prevent contaminations, we keep our activities at people's homes. So many of the interventions that were done in the physical installation started to be done at the houses of the people, or physically or digitally. So we did it in different aspects, depending on the situation of each patient itself. And the most important gain of all the process was we were able to intervene at their homes, and we were able to intervene for large cohorts at the same time. That was something that we never were able to do. So we managed to have sessions with 50, 60, 80 people at the same time, doing physical exercise, doing mindfulness, doing Reiki, etc. So that was for us the main gain of all the process. And what is interesting is that the first phase of the process, so the phase of creating the new model, only take around 3 weeks. So in 3 weeks, we managed to restart again an organization of 35 years old that was already with a lot of standard practices, with a lot of difficulty to change their minds. So, and in 3 weeks, we managed to make the completely revolution the organization and make all of them working as the digital world is normal backyard. So thank you all, and I'm keen to ask your questions and comments.
Thank you so much, Alexandre. That was excellent, and congratulations on your award. It's incredible. I'm going to open it up now for Professor Gupta to, if you have any comments or questions.
I think this is a wonderful work, and what I'm going to do, and I must thank and congratulate Paul for hosting this. We have this multiple sclerosis society in India. I'm going to connect to the president of that society with you. I think one of the big benefits of such forums is we wouldn't have been able to meet up or hear what you have done had this forum not been there. So I think there could be one possibility of learning from each other and even taking the work forward. That's, I think, one of the things that I can clearly see. And COVID has actually helped us do things which we probably never realized we could have done. So I think this is commendable, and I also congratulate you for winning this well-deserved award for your work.
Thank you very much. But one of the main challenges that we overcome was the notion that the organization can work bottom up. I think the most important lesson is that we are, as the board of directors, without their help, without the creativity of everybody, it would be almost impossible to do the change. So it was really the lesson learned here was, okay, the change happened because the people at the bottom were in the process. They feel empowered to make the change. So if the change was imposed by the top, I'm sure that we would not have such a success.
And yeah, and I was, when we were talking, we were talking before we were getting the session started, and Alexandre, how you had said that some people had said that it couldn't it couldn't happen that way, that people wouldn't want to do this, they wouldn't want to join in this way. Maybe you can comment a bit about that.
Yeah, one of our main difficulties, we were trying to change the organization. So we started, our mandate is trying to say to the people, what is important is that the people feel value in the organization, feel connected with the organization, feel part of the organization. So our organization was a very dispersed organization with chapters in many cities, but the chapters didn't have the habit to work with each other. So everybody was doing their own thing. Okay, there was some ideas that were transverse to the organization, namely the International Day, the National Day of Multiple Sclerosis. Normally, we had a common set of activities. But during the rest of the year, everybody was working their way. And with the pandemic, what we feel is that suddenly everybody understood that they should work together. That the problem was too big to be faced individually. So, and I think that was also part of the solution, is that everybody realized that alone they were not able to overcome the difficulties of the challenge.
Interesting.
Any either Paul or Professor Gupta, what's coming to your mind as you're hearing this?
At least for me, Laurie, I think this is a wonderful thing they have done to not only survive the organization during the pandemic, because if you didn't use technology, you wouldn't have survived. I think you brought a new dimension to the way you operate the organization. So it becomes like more asset light, it's more technology driven. And now I think any organization, if they ever document the best practices of what they learn, will help many more organizations working in the area of chronic diseases, be nimble, use technology, and serve a larger chunk of population. That's something I see as a clear outcome of this pandemic.
Yeah, we felt the same way. In a certain point, we were so embedded in working that the days or the week didn't have how we call it. It was all fluid. Everybody was pumping so many ideas that suddenly we were having professional discussions or job discussions, at Sunday night, at midnight Sunday night. So it was really a process in which everybody was so embedded, so strongly motivated, that was for me as a leader. I had a lot of difficulties to get on the pace they were putting on the development of things. And at a certain point, I said to them, "Oh, come on! I love your work, but don't put me, don't flood me with all your work. So try to select what you want my opinion, because I cannot give opinion on everything. So you are on a production level that I cannot
Wow.
withstand the pace."
Paul, did you have any comments?
Let me unmute here. No, definitely. This is so interesting that we are able to have a session here in parallel with the Portuguese session. I have to be in the two places at the same time. But at the same time, I'm so glad that we are able to record this conversation, that we will be able to share this on our Data Forum YouTube channel, and that Alexandre is so kind to share his awarded project, and Professor Gupta, the comments on the opportunities for cooperation in European Union and India in this regard. And this is a question for both. Do you see that it could be there are opportunities for two diverse regions so different in terms of stages of development and even economical strength, because we all know that India is one of the most populous country in the world, and also one of the most fast-growing economies too. Is there any things that we can learn with each other, given also the historical ties that there are between Portugal and India?
Yes, Paul. I mean, if I were to respond, I would say that Almighty has his own ways of doing things. You know, on one side we have countries which are, or the regions which are economically, you know, at a different pedestal, and if you look at technologically, India is at a different pedestal. So we are typically called the technology capital of the world for what we do in technology. The way Alexandre has moved his organization, you know, to do. I give you a simple example of collaboration of just what we discussed. I have a fellow board member who is the president of the Multiple Sclerosis Society of India, a similar society that Alexandre heads in Portugal. Now, imagine if these two people start interacting on what they did during the pandemic. Now that comes out to be a fantastic learning, and today learning leads to collaboration.
Mm-hmm.
So that is one I clearly see. And I think the Global Digital Health Forum was to be happening in Portugal this time, which we had initiated during our, role in the ministry, when I was advisor to the health minister. So we clearly see that pandemic has given us two standpoints, where on one side we are politically divided, but other side we need to be collaborative. The way to fight this global pandemic is to be together, not to be away from each other. I think that's the path we will take to become stronger, or else we will all face a more challenging time going forward. The world is one with diversity does not mean, divided. And that is what pandemic has taught us. Today, when we talk to the four of us are talking, we are learning. We are learning from each other. We are learning how we handle and manage our situation and people better with comorbidities, with morbidities. We cannot say simply, Alexandre, because you did this and you got an award, we are from India, we will not do this. We will just do the opposite. Will it help my people?
Yeah, sure.
Not at all. That's where the world is today. I think with this pandemic, we will have to eventually agree to one thing. The world is one. We need to collaborate. We need to learn. We need to allocate our resources, our learning, our experiences with each other and grow together. It is an equation that it cannot happen. If Portugal grows, India will not grow. The world is a situation where the ecosystem grows. We have to make the ecosystem grow. So Paul, I think this is a very pertinent question. India or Portugal and the world, the ecosystem is one. We need to learn from each other. We need to grow together. That's the ultimate message.
Yeah. And one thing that we learned in our intervention is that you don't need money, or Okay, you need money, but you don't need so much money. You need that the people come together and help each other, and especially in the digital setting, because you don't have heavy costs in commuting or basically you are at home, so you don't have the costs of being out of home.
Yeah.
So
Yeah.
and that help really to reach regions and people that otherwise cannot afford to come to Lisbon, to come to our chapters to get involved. So at the moment we can involve everybody, irrespectively where they are. So even we can do an intervention in India. Why not?
Mm-hmm.
So our physical therapists, our psychologists, our social workers, the skills they use are basically the same. It's international best practices.
Mm-hmm.
Of course, it needs to adapt to the regions, but that's the same here in Portugal. We need to adapt from the north to the south. We need to adapt from the seaside to the innerlands. So it's there are different realities. They have different problems, and I think the cooperation and the joint cooperation, the digital world simplifies all of that.
Mm-hmm.
I think the digital solutions can be, as the price we won, scalable. So we can do it for 8,000 patients in Portugal, but at the same time, it can be done to maybe 200,000 in India. I don't know the exact numbers, but it should be around 200,000 people with MS in India. So the solutions can be easily scalable in the digital world.
Yeah, I'm just. Oh, go ahead, Paul.
No, it's amazing to have this conclusion and to see that there's so relevant in this cooperation and the opportunities here that will make that will be so useful for each regions and for mankind.
Mm-hmm.
I'm so happy to realize this in this session.
Yes, absolutely. I'm looking at our time, everyone too, and I just want to make sure that everyone has time to have a break in between the sessions.
Yes, let's do that. Yes, because we will convene in room 1 at the top of the hour, right?
Yes. So if so I want to make sure to give everyone time just to stretch, get out a little bit. But I just want to thank you, Alexandre, for this wonderful presentation, and thank you, Professor Gupta, for joining us, and Paul for joining us. It's so exciting, just exciting for me to see this, and I'm hoping that it'll start traveling around the world, as we're saying. So very exciting. So thank you, and we can. If you know how to do this now, you can just go back to the Kiko chat area, and you can actually click on the main room when you're ready, and then you will actually, when you click on that, it'll ask you to just, do you want to go, you'll go up to the green area and say join the video, and you'll automatically go there. It's pretty cool. You can go in and out pretty easily.
Okay, we'll try that.
Okay, nice to meet you, and we'll see you at another session.
Thank you so much. Thank you.
See you in the next room.
Okay, bye.
See you. Bye. Bye.